The initial abnormalities that you're born with are a very narrow nostril, so his nostrils are actually pretty good, but they're often born with very narrow nostrils called stenotic nares. They often have excess turbinates inside their nose, and they have a long, soft palate. That's what you're born with. And then if you go through many, many years of struggling to breathe and creating a negative pressure in your airways because you're struggling to breathe, you often get secondary problems. You can get edema of your larynx, which is your voice box. You can get your trachea, which is held open by stiff cartilaginous rings, can start collapsing and narrowing the airway further. And you can get inverted laryngeal saccules, which is basically, if you think about where humans have tonsils, dogs have these little saccules. They'll basically get pulled out into the airway and again can reduce the airway diameter even further. All of this is just a fancy way of saying is that they're born struggling to breathe, and it just gets tougher as they age because of degenerative changes. So what can we do? Well, we could stop breeding these dogs. That's a kettle of fish I'm not even going to touch right now. But once they're born like this, what we can do is we can surgically open up the airway. And the earlier we do this in life, the better it is for the dogs, because then they don't suffer all the secondary negative effects of having a short face. So typically we recommend doing this during their spay or neuter procedure because they're going to be under anesthesia anyways. Might as well just fix the airways, which seems like really makes sense to me, but you know, it costs money and people worry about stuff. So not all these dogs get this done. And we're going to illustrate for you an example of the airway surgery. Not a Mickey here, because he's actually doing pretty well. And not all dogs with this conformation need the surgery. Some are born a little snub-nosed, but still kind of okay. So it really is a clinical judgment call that your veterinarian can make for you. Some of these dogs can actually have a really nice quality of life and do fine. Some of them really, really, really suffer and really need surgery. And it's just really sad doing that surgery at the age of 6 when you have all sorts of secondary complications and a dog has never breathed a proper breath in its life. So if your dog needs a surgery, it's much better to do it when they're like 8, 12 weeks old, getting their spay and neuter done. And that way they get to go through life with nice open airways, comfortable and being able to breathe, which quite frankly is something we all have a right to.